Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2023. This research, conducted by Tolga Karapiner, Kenan Kagri-Tummer, Peter D. Constable, and Sebastian M. C. Buksinski, investigates the factors that influence the concentration of ionized calcium in the blood of sick adult cattle and evaluates how well standard measurements of total calcium in serum reflect the actual status of this biologically active form of calcium. As we know, calcium disorders, particularly low blood calcium or hypocalcemia, are significant concerns in bovine medicine. In dairy cows around the time of giving birth, hypocalcemia can contribute to various metabolic and infectious diseases. Furthermore, it is frequently observed in cattle suffering from systemic illnesses or severe toxic conditions. Calcium in the bloodstream exists in three primary forms: bound to proteins, ionized, and complexed with other molecules. It is the ionized calcium that is the free, biologically active component of calcium in the blood, playing crucial roles in numerous physiological processes. While the concentration of ionized calcium in blood can be measured using specialized blood gas analyzers available in some veterinary hospitals, this technology may not always be accessible, especially in farm settings, and can present technical challenges. Consequently, veterinarians often rely on measuring the total calcium concentration in serum to assess a cow's calcium status. Previous research has suggested a strong relationship between total calcium and ionized calcium concentrations in the plasma or serum of adult cattle, with total calcium explaining a substantial portion of the variation in ionized calcium. A more recent study involving critically ill calves indicated that ionized calcium concentration was linked to total calcium, blood pH, chloride levels, magnesium, and lactate concentrations, but not albumin. It's also known that blood pH can affect ionized calcium levels, with pH-corrective equations used in human medicine showing similarities to those applicable to cow plasma. Interestingly, while ill newborn calves often develop metabolic acidosis, sick adult cattle are more prone to hypochloremic metabolic alkalosis, a condition characterized by low chloride and increased blood pH. These differing clinicopathological findings between young and adult cattle suggest that the factors influencing ionized calcium might vary between these groups. Given these observations and a common clinical experience of discrepancies between total and ionized calcium results in sick adult cattle, the researchers hypothesized that total calcium concentration alone might not be a reliable indicator of ionized calcium concentration in this population. Therefore, the objectives of this study were threefold. First, to determine the relationship between serum total calcium concentrations and blood ionized calcium concentrations in adult cattle with various diseases. Second, to investigate the association between venous blood pH, plasma concentrations of chloride, sodium, and potassium, as well as serum total protein, albumin, and globulin concentrations, and blood ionized calcium concentrations in these animals. And third, to determine the percentage of blood ionized calcium relative to total calcium in cattle with different diseases. To address these objectives, the researchers conducted a prospective study involving 265 adult cattle, 1 year of age or older, with a variety of illnesses. These cattle were patients at the Feiret University Teaching and Training Animal Hospital between January 2018 and April 2019. The study included various breeds, and the animals ranged in age from 1 to 12 years. A large majority were female, and a significant proportion of the cows were lactating. Cattle that had received calcium treatments within the 48 hours prior to blood sampling were excluded to avoid any influence from these interventions. The final clinical diagnosis for each animal was determined based on clinical evaluation, and in cases with multiple diseases, the primary diagnosis was recorded. Blood samples were collected anaerobically from the jugular vein into specialized blood gas syringes and plain tubes. Measurements of whole blood pH, ionized calcium, sodium, potassium, and chloride were performed within 10 minutes of collection using a blood gas and electrolyte analyzer. Serum for total calcium, total protein, and albumin measurements was obtained by centrifuging the blood in plain tubes, and these serum samples were stored at -20 degrees Celsius until analyzed within 7 days using an autoanalyzer. Globulin concentrations were calculated as the difference between total protein and albumin. The precision of the measurement methods was evaluated, showing acceptable coefficients of variation. To assess the ability of total calcium measurements to detect abnormal ionized calcium levels, the researchers calculated the sensitivity and specificity of total calcium for diagnosing hypocalcemia and hypercalcemia based on ionized calcium reference ranges. Diagnostic discordance. representing the percentage of cases where total and ionized calcium measurements led to different classifications of calcium status, was also determined. Statistical analyses were performed to explore the relationships between ionized calcium and the various blood parameters, both unadjusted and adjusted for a standard pH of 7.40. Multivariable regression models were constructed to identify the independent predictors of ionized calcium concentration. Now let's move on to the results of this comprehensive study. The study population of 265 sick adult cattle presented with a wide array of clinical diagnoses. Gastrointestinal disorders were the most common, followed by respiratory and systemic diseases, as well as cases of acute mastitis, reproductive disorders, metabolic disorders, and other miscellaneous conditions. The researchers observed a broad range of values for all measured blood parameters, including pH, ionized calcium, chloride, sodium, potassium, total calcium, total protein, albumin, and globulin concentrations. When categorizing the cattle based on ionized calcium levels, they found that 36.2% were hypocalcemic, 60% were normocalcemic, and 3.8% were hypercalcemic. However, when using serum total calcium concentrations as the basis for classification, a different distribution emerged, with 42.6% classified as hypocalcemic, 57% as normocalcemic, and only 0.4% as hypercalcemic. The sensitivity of serum total calcium measurements in detecting abnormally low ionized calcium was 66%, while the specificity in correctly identifying normal ionized calcium levels was 72.3%. The positive likelihood ratio, which indicates how much more likely a patient with abnormal ionized calcium is to have an abnormal total calcium result, was 2.39. Conversely, the negative likelihood ratio, which indicates how much less likely a patient with normal ionized calcium is to have a normal total calcium result, was 0.47. The overall diagnostic discordance between total calcium and ionized calcium measurements was a notable 30.2%. Specifically, in cattle identified as having low ionized calcium, the diagnostic discordance with total calcium was 27.1%. Statistical analyses revealed significant relationships between ionized calcium concentrations and several other blood parameters. They found positive correlations between ionized calcium and total calcium, as well as plasma chloride and potassium concentrations. Conversely, there were negative correlations between ionized calcium and blood pH and plasma strong ion difference. Univariable regression analyses, which examine the relationship between a single predictor variable and the outcome, showed that potassium, chloride, blood pH, and total calcium were significantly associated with both unadjusted and pH-adjusted ionized calcium concentrations. Interestingly, older cows tended to have lower ionized calcium results compared to younger cows. Differences in ionized calcium were also observed based on the type of disease and the sex of the animal, with males generally having higher ionized calcium levels than females. The median percentage of blood ionized calcium relative to total serum calcium in the study population was 53.8%, with a considerable range from 24.3% to 68.8%. Multivariable regression analysis, which considers the combined effects of multiple predictor variables, identified serum total calcium concentration and plasma chloride concentration as the strongest positive predictors of pH-adjusted ionized calcium concentration in sick adult cattle. Plasma potassium also showed a positive association. In contrast, serum albumin concentration exhibited a negative association with ionized calcium. The final multivariable model, including total calcium, chloride, potassium, and albumin, accounted for 73% of the variance in pH-adjusted ionized calcium concentration. Specifically, total calcium alone accounted for 42% of this variance, while plasma chloride contributed an additional 21%, and plasma potassium a further 9%. Blood pH and serum albumin concentration, while showing significant associations in univariable analysis, did not emerge as strong independent predictors in the final multivariable model for pH-adjusted ionized calcium. The researchers also noted that sodium and chloride concentrations were highly correlated, as were globulin and total protein concentrations. Therefore, to avoid issues of multicollinearity in the regression analysis, only chloride and globulin, the latter not being a significant predictor in univariable analysis, were included as representative variables from these correlated pairs. Tests for multicollinearity in the final models did not indicate any significant problems. Now, let's consider the discussion of these findings and their implications for veterinary practice. The study's primary conclusion is that serum total calcium measurements are not reliable for accurately predicting blood ionized calcium status in sick adult cattle. The significant diagnostic discordance observed, with over 30% of cases being misclassified based on total calcium alone, highlights this limitation. The poor sensitivity of total calcium measurements in detecting low ionized calcium further underscores this point, meaning that many cattle with truly low biologically active calcium would be incorrectly identified as having normal calcium levels. The low positive likelihood ratio and a negative likelihood ratio greater than 0.1 also indicate that total calcium is not a good test for either confirming or ruling out abnormal ionized calcium status in this population. These results align with previous findings in dogs, where similar discrepancies between total and ionized calcium have been reported. The high diagnostic discordance specifically in cattle with ionized hypocalcemia, 27.1%, is particularly concerning from a clinical perspective, as it suggests that reliance on total calcium could lead to underdiagnosis and potentially inadequate treatment of this condition. Therefore, the authors emphasize that ionized calcium measurements should be performed whenever feasible in sick adult cattle to obtain a more accurate assessment of their calcium status. The study acknowledges the limitations in available reference intervals for ionized calcium in cattle and notes that the range used was derived from a study involving healthy Swedish red and white breed cows using a different analyzer. The authors call for further research to establish robust reference ranges for ionized calcium in healthy cattle populations using currently available analyzers. The reference range for total calcium used in this study was consistent with commonly used values in clinical practice. The study also considered the potential impact of sample handling and storage, concluding that the methods used likely did not significantly affect the total calcium measurements. The multivariable regression model provided valuable insights into the relationships between various blood parameters and ionized calcium. The strong positive association observed between plasma chloride concentration and ionized calcium was a key finding. This relationship is thought to be due to the direct binding of chloride ions to bovine albumin, which displaces calcium from its binding sites, thereby increasing the concentration of free, ionized calcium. This phenomenon has been observed in other species as well. Interestingly, the effect of chloride on ionized calcium appeared to be independent of its influence on blood pH. Clinical observations, such as the increase in ionized calcium without a change in total calcium following the feeding of acidogenic rations high in chloride, and the higher ionized calcium levels achieved with intravenous calcium chloride compared to calcium borogluconate, further support this direct effect. The authors suggest that clinical evaluation of total calcium in sick adult cattle would benefit from the simultaneous assessment of blood chloride concentration due to this significant direct effect. While univariable analysis indicated a negative association between venous blood pH and ionized calcium, this relationship was weaker in the multivariable model. The researchers suggest that the higher median blood pH observed in their population of sick adult cattle compared to critically ill neonatal calves in a previous study might explain this difference. Plasma potassium concentration was found to be positively associated with ionized calcium in this study, accounting for a portion of the variation. This contrasts with findings in critically ill neonatal calves where no significant association was observed. The authors propose that this positive correlation in sick adult cattle might reflect the combined effects of reduced intake and increased losses of both calcium and potassium, particularly in lactating animals and those with gastrointestinal disease. Their findings suggest that fluid therapy containing chloride and potassium in sick adult cattle may lead to an increase in ionized calcium levels. Serum albumin concentration showed a significant but weak negative association with ionized calcium in the multivariable model, accounting for only a small fraction of the variation. This suggests that, unlike in some other species, simultaneous evaluation of serum albumin might not be essential when interpreting total calcium in sick adult cattle. The study also examined the percentage of total calcium that exists in the ionized form, finding a median of 53.8% with a wide range. This range was broader than that observed in critically ill neonatal calves. The authors highlight that the common assumption that approximately 50% of calcium in bovine blood is ionized may not hold true for sick cattle, as a significant number of animals in their study had ionized calcium percentages above 55%. They observed lower median ionized calcium percentages in cattle with gastrointestinal disorders compared to those with other systemic diseases, although even in the former group, the median was still above 50%. The authors acknowledge some limitations of their study, including the lack of measurements for other biochemical variables known to be associated with ionized calcium in other contexts, such as non-esterified fatty acids, beta-hydroxybutyric acid, magnesium, and lactate. They also note the relatively small number of early postpartum cows in their study population due to the exclusion criteria aimed at avoiding interference from calcium treatments. They suggest that further research, particularly in paraparturient dairy cows, should investigate the role of these additional analytes in influencing ionized calcium concentrations. In conclusion, This study provides compelling evidence that serum total calcium concentration alone is not a reliable predictor of blood ionized calcium status in sick adult cattle. The strongest predictors of ionized calcium were found to be total calcium, plasma chloride, and plasma potassium concentrations. The authors recommend that accurate clinical evaluation of calcium status in sick adult cattle using total calcium measurements would benefit from the simultaneous evaluation of plasma chloride and possibly potassium concentrations, especially given the common co-occurrence of hypochloremia, hypokalemia, and hypocalcemia in these animals, particularly those with primary gastrointestinal diseases. The study underscores the importance of considering the complex interplay of various electrolytes and blood parameters when assessing calcium status in this important animal population. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.